Welcome to the NCLEX question banks. Without further ado, let's dive into the questions now.
Number 1. A nurse is caring for a client with heart failure who has been prescribed furosemide, also known as Lasix. Which assessment finding requires immediate intervention? The answer is B. Serum potassium level of 3-point furosemide is a loop diuretic that can cause hypokalemia. A potassium level of 3 is below normal, 3.5 to 5.0, and increases the risk of cardiac dysrhythmias. Immediate intervention, e.g., potassium supplementation, is needed to prevent complications. Number 2. A client with a history of chronic obstructive pulmonary disease is receiving oxygen therapy at 4 liters per minute via nasal cannula. The nurse should Answer B. Encourage pursed lip breathing. Clients with COPD have chronic CO2 retention, and too much oxygen can suppress their drive to breathe. Pursed lip breathing helps slow exhalation, prevent air trapping, and improve gas exchange. Increasing the oxygen flow rate can be dangerous in these clients. 3. The nurse is caring for a postpartum client who is Rh negative and gave birth to an Rh positive baby. Which action is priority? Answer A. Administer Rho-D immune globulin, RhoGAM, within 72 hours. If an Rh-negative mother gives birth to an Rh-positive baby, she must receive RhoGAM within 72 hours to prevent Rh sensitization, which could cause hemolytic disease in future pregnancies. 4. A nurse is caring for a client diagnosed with myasthenia gravis, MG. Which meal option is most appropriate for this client? Answer B. Mashed potatoes with ground turkey and gravy. Clients with MG have muscle weakness, including the muscles used for swallowing. Soft, moist foods are the safest option to prevent aspiration and choking. 5. A client with type 1 diabetes is found unconscious with a blood glucose level of 40 milligrams per deciliter. What is the nurse's priority intervention? Answer C. Administer V-dextrose 50%, D50. A blood glucose level of 40 milligrams per deciliter is severe hypoglycemia, and the client is unconscious, meaning they cannot take oral glucose safely. IV dextrose is the fastest way to restore blood sugar and prevent complications like seizures. 6. The nurse is assessing a client who has just received morphine for pain relief. Which finding is most concerning? Answer A. Respiratory rate of 8 breaths per minute. Morphine is an opioid analgesic that can cause respiratory depression. A respiratory rate below 12 breaths per minute is concerning, and a rate of 8 breaths per minute requires immediate intervention, possibly including naloxone, Narcan. 7. A client with a deep vein thrombosis, DVT, is receiving heparin therapy. Which laboratory value should the nurse monitor closely? Answer C. Activated partial thromboplastin time. Heparin therapy affects the intrinsic clotting pathway, and the effectiveness is monitored using a PTT, which should be 1.5 to 2.5 times the normal range, 25 to 35 seconds. An INR is used for warfarin Coumadin, not heparin. 8. A nurse is preparing to administer digoxin to a client with heart failure. Which assessment finding requires the nurse to withhold the medication? Answer: B. Heart rate of 48 beats per minute. Digoxin slows the heart rate, so it should be held if the HR is below 60 beats per minute. Bradycardia, nausea, and blurry vision may indicate digoxin toxicity, which can be worsened by hypokalemia. 9. A client with cirrhosis is receiving lactulose. The nurse knows the medication is effective when the client. Answer: B. Has 2 to 3 soft bowel movements per day. Lactulose is given to reduce ammonia levels in cirrhosis clients. The goal is 2 to 3 soft stools per day, which help excrete ammonia and prevent hepatic encephalopathy. 10. A client is admitted with severe burns. Which IV fluid does the nurse anticipate administering first? Answer: B. Lactated Ringer's rationale. Lactated Ringer's, LR, is the fluid of choice for burn resuscitation because it contains electrolytes and helps correct fluid shifts and metabolic acidosis. 11th. A nurse is teaching a client about warfarin, Coumadin. Which statement indicates the client needs further teaching? Answer: D. I can take ibuprofen if I have a headache. Rationale: ibuprofen and other NSAIDs increase bleeding risk when taken with warfarin. Clients should use acetaminophen, Tylenol, instead. 12th. A client with increased intracranial pressure, ICP, is prescribed mannitol, osmetrol. Which finding indicates the medication is effective? Answer: C. Increased level of consciousness. Rationale: mannitol is an osmotic diuretic that reduces cerebral edema and lowers ICP. A positive outcome is improved neurological status, e.g., increased LOC. 13. A client with an acute asthma attack is experiencing severe dyspnea. Which medication should the nurse administer first? Answer: C. Albuterol. Rationale: albuterol is a short-acting beta agonist, SABA, and is the first-line rescue medication for acute asthma attacks. Fluticasone and montelukast are for long-term control. 14. A nurse is assessing a client in the emergency department after a motor vehicle accident. The client has a femur fracture and is complaining of severe pain despite receiving opioid medication. The nurse notes restlessness, confusion, and petechiae on the chest. What is the priority action? Answer: B. Notify the healthcare provider immediately. Rationale: petechiae, confusion, and restlessness in a client with a long bone fracture are signs of fat embolism syndrome, a medical emergency. Immediate intervention is required. 15. The nurse is preparing to administer vancomycin V to a client with MRSA. What action is most important? Answer: A. Administer the drug over at least 60 minutes. Rationale: vancomycin must be infused slowly, over 60 minutes or more, to prevent red man syndrome, a histamine reaction causing flushing, hypotension, and rash. 16. A nurse is caring for a client with pneumonia who is experiencing shortness of breath. Which position is most appropriate? Answer: B. High Fowler's position. Rationale: high Fowler's, 90 degrees, allows for maximum lung expansion, improving oxygenation and reducing dyspnea. 17. A nurse is preparing to administer enoxaparin, Lovenox, to a client. What is the correct injection site? Answer: C. Abdomen, 2 inches from the umbilicus. Rationale: enoxaparin, Lovenox, is a subcutaneous anticoagulant that should be given in the abdomen, avoiding areas near the umbilicus, scars, or bruises. 18. A nurse is reviewing the ECG of a client with hypokalemia. Which finding is most likely? Answer: C. U waves. Rationale: hypokalemia, less than 3.5 milliequivalents per liter, causes U waves, ST depression, and flattened T waves. 19. A nurse is teaching a client with gastroesophageal reflux disease, GERD. Which statement indicates further teaching is needed? Answer: C. I should lie down immediately after eating. Rationale: clients with GERD should remain upright after meals to prevent acid reflux. 20. A client with diabetic ketoacidosis, DKA, has a blood glucose of 250 milligrams per deciliter. What is the next nursing intervention? Answer: A. Stop the insulin infusion and start IV dextrose. Rationale: once glucose reaches 250 milligrams per deciliter, IV dextrose is added to prevent hypoglycemia while continuing insulin to clear ketones. 21st. A nurse is teaching a client about lithium therapy for bipolar disorder. Which statement requires further teaching? Answer: B. I will limit my salt intake. Rationale: lithium and sodium compete for kidney excretion. Low sodium increases lithium toxicity risk. Clients should maintain normal salt intake. 22nd. A client with Cushing's syndrome asks why they have developed purple stretch marks. What is the best explanation? Answer: A. Your skin is thinning due to excess cortisol. Rationale: Cushing's syndrome causes skin fragility and purple striae due to prolonged exposure to cortisol. 23rd. A nurse is preparing to administer IV potassium chloride, KCl, to a client with hypokalemia. What is the safest way to administer this medication? Answer: C. Dilute potassium and infuse no faster than 10 milliequivalents per hour. Rationale: IV potassium must never be given IV push due to fatal cardiac arrhythmias. It must be diluted and infused no faster than 10 milliequivalents per hour via peripheral IV or 20 milliequivalents per hour via central line. 24. A nurse is caring for a client with increased intracranial pressure, ICP. Which intervention is most appropriate? Answer: B. Cluster nursing care to minimize disruptions. Rationale: Frequent stimulation increases ICP. Clustering care reduces excessive handling and promotes ICP control. 25. Which client is at highest risk for a stroke? Answer: B. A 55-year-old with diabetes and hypertension. Rationale: Hypertension and diabetes are the strongest risk factors for stroke. All right, that was it for today. Great job if you made this far. If you found this video helpful, don't forget to subscribe the channel and like this video. And for more study guides and lectures and many more question banks, check out our website, www.yournursingspace.com. Happy studying!